please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Diabetes. It's a disease that's often called the silent killer. In India alone, as many as 69 million people are living with type 2 diabetes, and in the recent past, our nation has even been christened as the diabetes capital of the world. Yet the awareness about this killer disease is still quite poor. Hello and welcome to Live Well with Diabetes, a special series that aims to spread awareness and educate people about diabetes. On every episode, we meet renowned doctors and specialists from different cities in India, and today we are coming to you from the National Capital Region. Our topic of discussion today is diabetes in women and children. And to tell us more about this, we are joined by three renowned doctors from Delhi NCR. Dr. Beena Bansal, Director Endocrinology and Diabetes, Medanta, the Medicity, Gurugram. Dr. Ajay Agarwal, Head of Endocrinology and Diabetes, Fortis Hospital, Shalimar Bagh, New Delhi. And Dr. Dheeraj Kapoor, Head of Endocrinology and Diabetes at Artemis Hospital, Gurugram. Welcome, Dr. Beena. Welcome, gentlemen. Thank you for joining us on the show today. Let's begin with understanding, Dr. Beena, what exactly is diabetes? We've all heard the term. We all know that it's a killer disease. But educate us a little bit on what exactly is diabetes and how different is it in women when compared to men or children?
Okay. So, diabetes by definition is high level of glucose in blood. Level high enough which can impact organs in future, for example, your eyes, kidneys and heart. So, we define diabetes as a fasting level more than 126 and 2 hours after eating more than 200, because this is a level which has been found in studies to be associated with risks of future disease. In women, there are certain unique things. It's a troubling fact that diabetes is also a little unfair to women. And usually women are protected against heart disease, for example. So there are 2-3 unique things biologically. Yeah. Before menopause, especially women are protected against heart disease, but in presence of diabetes, that protection is lost. So women with diabetes is at least 6 times higher risk for getting heart disease as compared to women without diabetes. Whereas in men, the risk is only increased by 2 to 3 times if diabetes is present. Right. And also it is more fatal or deadlier in women than men. Right. So if heart disease affects women, the mortality rates had been found to be little higher than men.
Let me also get in Dr. Ajay Agarwal at this point. What is the difference between diabetes in a child and an adult, and how prevalent is diabetes in children really?
You know, majority of patients who come to us with diabetes, they are adults. Children has different diabetes from the adult. It's like adults, they need tablets, later on they need insulin. But in children, it's type 1 diabetes, they need insulin from the very beginning.
Right.
Another problem is...
So they're born with it? No,
not they're born with it, they get diabetes at a very younger age group. Sometime at birth also, maybe at any age group, till we say below 18 years, we say it's in the like childhood or adolescent diabetes.
Right.
The diabetes in children is type 1 diabetes, they need insulin from the very beginning. But you know, the problem is, these days we are getting children with type 2 diabetes. As kids are gaining weight, they are more into not good habits, they fast food, less exercise, they are gaining weight.
Right. So more sedentary lifestyle.
Sedentary lifestyle, more and more of them, they are getting type 2 diabetes.
Right.
Earlier, you know, this was very rare in India. But we are having, at least in our hospital, we are getting 1 or 2 children of 14, 15 of age who are coming with type 2 diabetes.
Oh, that's quite alarming.
Now, the another thing is, what about the prevalence? It's extremely rare as compared to adults.
Right.
Like, you know, out of 1,000 patients, the childhood diabetes is just in 1 or 2%, 1 or 2 patients. Right. So it comes around less than 2%. And like I can't say in adults, it's only type 2 diabetes. Some adults are also coming up with type 1 diabetes.
I see.
They need insulin. So we cannot generalize. We can say adults have type 2 diabetes and children have type 1.
All right. Dr. Dheeraj Kapoor, what are the probable reasons for diabetes in children and what are the early signs and symptoms that parents should watch out for?
The cause of type 1 diabetes is autoimmunity, wherein antibodies are formed in our own body against the pancreas,
Right.
the organ which generates insulin, and it is destroyed by the day and the child becomes a diabetic. Similarly, type 2 diabetes, extremely uncommon, but the weight gain and the insulin can't act the way it should. Resistance. So, you are flogging pancreas by the day to make more insulin, and a time comes when it sits down.
Right.
That's the time when the child gets type 2 diabetes. So, type 1 diabetes, it's a bolt from the blue. The child comes with increased urination, increased thirst and dehydration and comes to our hospitals or clinics. The child is dehydrated, you can see lean, thin, emaciated child and unable to do the daily chores because of the tiredness, and that's the time we check the blood sugars and they are found to be on the higher side, maybe 400 or thereabouts. There's one test called urine ketones or the ketones, which are in a layman's language acids form in the body, and that is an absolute indication to admit the child.
Right.
So, if you ask me 3 things, well, increased thirst, increased urination and weight loss.
All right. And Dr. Beena, what about gestational diabetes? What exactly is gestational diabetes and what are the probable causes of this?
Okay. Gestational diabetes means diabetes which is diagnosed during pregnancy.
Right.
So, a pregnant woman can have diabetes which is pre-existing before pregnancy, which can be either type 2 or type 1, but very commonly they can develop diabetes during pregnancy, which is as common as 8 to 10% in India. And that happens because the placenta forms some hormones which act against insulin. So, insulin is supposed to control blood glucose. If there is something acting against it, insulin is not able to act properly, and this is called insulin resistance. So, usually the pancreas is able to manage and increase insulin levels and take care of this increased requirement of insulin, but sometimes it is incapable of doing so, and those women would develop higher sugars during pregnancy. And the cutoffs for diagnosing diabetes in pregnancy is much lower. So, they are labeled as diabetes at a much lower blood glucose. It's not 126 fasting, it's 92 fasting, for example. So, and they need to maintain glucose levels at a much lower levels as compared to non-pregnant people.
Okay. All right. And Dr. Ajay, gestational diabetes, like Dr. Beena said, happens during pregnancy. But if a woman already has type 1 or type 2 diabetes, is it safe for her to get pregnant?
Yeah, it is safe for her to get pregnant, but before that we need counseling, like blood sugar has to be under control, only then they can plan pregnancy.
Right. And what are the specific risk factors for women with diabetes?
See, I'll tell you very specifically. All Indians are high risk. That closes the chapter there. But otherwise, traditionally, an overweight girl with PCOS, which is the polycystic ovaries, previous delivery of more than 4.5 pounds.
Right.
Certain races, we are being amongst them. Then the history of diabetes in family, a hypertensive or someone has high cholesterol. All of these women are more prone to GDM once they conceive.
Even age more than 25 is a risk factor. Any lady who becomes pregnant after 25 years of age is at risk for gestational diabetes.
All right. Will this diabetes during pregnancy affect the baby in the womb? Is the baby likely to be born diabetic?
So, let me first start with the statement that someone who has diabetes can safely plan pregnancy. So, that goes without saying. But it should be well managed. If the glucose levels remain high during pregnancy, especially if the pregnancy was pre-existing, then there can be effect on organs. So, for a woman with diabetes, the pregnancy should always be a planned pregnancy. So, that is one thing. But if she develops diabetes during pregnancy, which usually happens after the organ formation has been, it's finished. So, the only problem the baby faces is increased body weight because the baby gets more of glucose through placenta, and that increases insulin levels in the baby as well, and therefore the size can increase because insulin is an anabolic hormone. And these large size babies, one, that can cause problems during delivery. There is an increased risk of some complications immediately after delivery, that is low glucose or jaundice. But more importantly, if the size of the baby is large at delivery, then the chances of getting diabetes in future is much, much higher.
Right.
So at the age of 22, it's as high as 10 to 13%. Like that's very high. A very young child can develop diabetes. So therefore, a proper management of diabetes is required, but that is not a deterrent for planning pregnancy in anyone who has diabetes.
All right. So that's about women. Let's talk a little bit about children who have diabetes, who are living with diabetes as well. Dr. Ajay Agarwal, will the growth of a child be normal if he or she is living with diabetes? Because that's a concern that most parents have, that is my kid going to grow normally? Is he or she going to be able to have a normal lifestyle?
You know, if blood sugar is uncontrolled, it can definitely impact the growth. But if blood sugar is under control, I think they can grow as normal as any other child. Now, another problem in type 1 diabetes patients, they are very commonly, they have got thyroid problems.
Right.
They have got a problem like a gluten allergy, that is celiac disease. You know, 10 to 15% of children with type 1 diabetes has these problems.
Right.
So these problems itself can be cause of growth, delay in the growth. So like in any diabetic child, we have to find out, diagnose these problems, and if there are these, we have to treat it. Like treat these problems, keep sugar under control, give adequate nutrition. I don't think there is any reason they will not grow normal.
All right. Dr. Kapoor, would you like to add, what are the treatment options available for children who are living with diabetes?
See, so type 1 diabetes is insulin requiring. Huh?
Yeah.
So these children require insulin for survival. Type 2 diabetes, they can work on tablets as well. Metformin is the one which is used. As in all guidelines across the globe, that is the first drug to be given in type 2 diabetics. So children can be given. But type 1 diabetes, which still forms the major chunk of diabetes in children, you have to have insulin. Now, it can be 2 times a day, it can be 4 times a day, depending from child to child how his sugars are managed. So basically, for now, it has got to be insulin.
All right. Okay, so on that note, let's take a short break right now. On the other side, we'll talk about the support that parents can extend to their children who are living with diabetes. Stay with us on our special series, Live Well with Diabetes. To live well with diabetes. Today, I'm joined by a panel of doctors in the National Capital Region, and we are talking about the prevalence of diabetes in women and children. Dr. Ajay Agarwal, what kind of dietary and exercise routine habits would you suggest for a child who is living with diabetes?
See, they can eat anything in the world. We don't, like we do a lot of restriction on them. They can have good adequate diet with all nutrition, vitamins, minerals. You know, like in diabetes, we say sugar has to be avoided. Okay, you don't give high calorie diet, saturated fats.
Right.
But occasionally if sugar is under control, they can take sometime ice cream, like things like ice cream or some sweets. But majority of the time, we have to be with the nutritional and balanced diet.
Right.
And what was another point?
And as far as exercise is concerned?
Yeah, like moderate exercises are good enough. They can do cycling, swimming, walking. But the problem with exercise is type 1 diabetes is the heavy exercise can cause low blood sugars. So before doing any heavy exercise, they need to take some extra carbohydrate or diet.
Right. But Dr. Bina, it's quite difficult and challenging to control the diet of a child. What do you do when you have to send your child to a birthday party, there is a cake being cut?
As Dr. Ajay already pointed out, so type 1 diabetes is different. Here there is deficiency of insulin. Here we are not dealing with obesity or overweight problems. What needs to be understood is that the carbohydrate and the insulin which is being taken from outside has to be matched.
Yes.
So all which has to be done is that proper carbohydrate counting is needed, and then anything the patient can eat, with the thing in mind that if the diet varies quite a lot, then insulin dose adjustment becomes difficult and glucose would unpredictably vary. Otherwise, going to a birthday party, eating anything during a birthday party is not a no at all.
Okay, and Dr. Kapoor, but for children and their parents, it is a big deal when a child is diagnosed with diabetes. So what's your advice to parents on how to deal with children and how to really ensure that they're not mentally bogged down by knowing that they are living with diabetes?
So if the child is diagnosed to have diabetes in a very young age, maybe 3 or 4 years, it's the parents who have more of a problem than the child per se.
Right.
And really, it's a diagnosis bolt from the blue, so they are really distressed and one has to address that. So first of all, one needs to be very clear that the goal of blood sugar maintenance in a child is far, far higher than an adult. So, the unrealistic goals should be told that no, they are not on, it should be a relaxed level, that is one. Carbohydrate counting, so the child can be allowed to have most things, but the problem is that in India, counting is not in vogue.
Right.
So, that is the problem that we face. Secondly, if a child has diabetes, he tends to be slightly more pampered as compared to the other sib. See, there are two issues. Either the sib will be pampered or this child. It's the child who ends up, and therefore, he may start throwing tantrums, and that may be a problem. This is at the home. Now, at school the teacher should be told, look here, this child is a diabetic. If he is drowsy or behaves unusually, the sugars must be checked. There should be insulins at the school place in the refrigerator. The nurse or even the teacher can be trained to do that. And of course, the diagnosis should be kept as close as possible from the children, because that may also cause problems and depression among the child who has diabetes.
Yes.
So, this is a varying factor. So, in maybe earlier teens or the late 8s and 9s, the child may get distressed somehow, but in the younger age group, it's the parents who need to be counseled more than the child himself.
Right, right. Dr. Beena, would you like to add to that? A number of schools are not compassionate enough and not aware enough as well as far as...
They are more scared than anything else. I don't think compassion is a problem. It's not knowing about the disease, and of course the teachers and the school kids.
So your advice to faculty members of schools who are dealing with children who are living with diabetes?
They should learn about the disease and try and sensitize other kids so that the child is more open about the presence of the disease.
Yes, there is a lot of social stigma attached.
There is a stigma which starts very early on. All kids invariably would try to hide it, and the layers add up with growing age, leading to lots of psychological problems later in life. So they have to be like, the empowerment starts from the family, the kid has to be told, and of course the friends have to be sensitized. And kids are very resilient, so if other kids are sensitized enough, they accept it in a much better manner than adults do actually.
Right.
So that's a good age group to start. Family wise, I would say that actually the single most important factor which is associated with good glycemic control or good glucose control in type 1 diabetes all throughout life is family support. That all throughout studies. How the family deals with it, the kid learns, and kid would actually simulate that as an adult. So parents need to be told that the child is looking at you and learning.
Right.
So how they react, how they behave is what
That's
the
most
child
important.
will copy. Yes.
All right. Okay, so as we wrap up this conversation, let me ask each one of you for one positive message to end this show with, a message for women and children who are living with diabetes. Dr. Kapoor?
So, the woman is the caretaker of the family, and to do that, she should take care of her own self so that things don't advance to a lifestyle stage.
Dr. Ajay?
My advice is for the parents of children with type 1 diabetes, treat your children like any other normal child, no special attention.
Okay. Dr. Beena?
I would say that diabetes is not a disease, it's just another lifestyle, and that's just an attitude which matters.
Okay, thank you so much, doctors. It's been a pleasure talking to you. With that, it's a wrap of this episode of Live Well with Diabetes. Hope you enjoyed those insights. Remember, it's important to stay happy, stay healthy, and stay positive. Thanks for joining us. Goodbye.